everyone. Today we're talking about a joint that's famous for causing pain, but is very rarely really and truly understood, and that is your SI joint. Most people think of it as a low back problem, but I'm going to show you how its function or its dysfunction dictates everything from how you walk to how you squat. If you're ready to understand the real source of your hip or pelvic pain, hit like and subscribe to Biomechanics Solutions, and specifically the Optimal Movement series. So let's dive in. First, what is it? The sacroiliac joint, or SI joint, is where your sacrum, the triangular bone at the base of your spine, connects to your ilium, or your hip bone, on each side. It is not meant to be totally rigid or super mobile. Its optimal function is controlled micromovement, specifically nutation and counternutation. And that's nutation with an N, not an M. Nutation is the sacrum tipping forward relative to the hip bones. Counternutation is it tipping back. This slight motion is crucial as it acts as a shock absorber or a force distributor for your entire upper body weight into your legs and vice versa. Optimally during walking, as you step onto your right leg, your right hip bone rotates slightly backwards. So your leg goes forwards and your hip tips back just a little bit. The tension in the ligaments allows for the right side of your sacrum to nutate or tip forward. So the wing of your pelvis tilts back, your sacrum, that little triangular bone, will tilt forward a little bit. This creates a stable locked position to help you support your body weight. Then it reverses as you push off. This rhythmic, subtle motion is what allows for smooth, pain-free gait and load transfer. Now, here's the crucial connection. Your femur is the lever that influences your pelvis. Think of it this way. Your femur sits in your hip socket, which is part of your hip bone. How your femur moves determines the position and the stability of that entire hip bone, which directly affects the SI joint on that same side. The optimal relationship of the SI joint to your femur is that when you stand on one leg, a stable, well-aligned femur helps maintain a level pelvis. This allows for the sacrum to nutate properly on the weight-bearing side, stabilizing the SI joint for load transfer. The femur and the SI joint are in a cooperative partnership. When the SI joint loses its optimal controlled movement, this partnership breaks down. The dysfunction typically falls into two basic categories, and each has a dramatic effect on how your femur moves and how you feel. Your first deviation is an unstable SI joint. In this deviation, the SI joint has too much motion. It's unstable. It kind of moves freely and not directly in relationship to the motion that is happening. The ligaments are lax, and the sacrum can't achieve a stable nutated position under load, meaning that when you load that joint, it moves far more freely than we would like it to. What this feels like is a sharp, pinching pain right in the SI joint cleft, especially during single leg activities or walking. It often feels like your pelvis is shifting or slipping, and you feel like there's something pinched in the middle of your leg, your outside of your hip, and the base of your spine. Because it's unstable, the femur loses its stable base. The body strategy is often to grip with muscles. You'll see the thigh bone pull into internal rotation and adduction. This will look like down the chain like being knock-kneed, but really it's your body fighting to stabilize the hip joint in whatever way it can. You might see someone swing their leg outward, which is called circumduction, to avoid the painful pinching at the heel strike. The overworked muscles that are trying to compensate are your adductors, your TFL, and your piriformis, leading into that classic deep pain or extensive groin tightness. Your number two most often seen deviation is a stiff or locked SI joint. Here, the SI joint is stuck, usually in counternutation, which, if we remember, it's when your sacrum is tilted back. It has lost its shock absorbing micromotion. What does this feel like? It feels like a deep, diffuse stiffness and aching across the entire low back and pelvis. It feels locked up, making it hard to bend or rotate your torso smoothly. A locked pelvis does not rotate well. During walking, you'll lose normal pelvic rotation, leading to a short, shuffling stride. The big impact is on squatting and hinging. Because the SI joint cannot nutate or tilt forward to accept the load, the motion has to come from elsewhere. In the squat, the lumbar spine often flexes excessively at the bottom in this deviation. That's the butt wink is what we see, as it tries to find depth that the hips cannot provide. In the hinge, you'll feel a premature stretch in the hamstrings and a sense of bony compression in the front of the hips because the femur is jamming into the socket. The glutes often feel inactive because the bony alignment for their function is compromised. You'll often hear me refer to this as lacking posterior hip glide, which is another application of SI joint dysfunction to an entire system. But that is how it will often present itself, and a stiff SI joint is part of that systemic problem. The goal is not to mobilize or stabilize blindly. It's to restore the SI joint's capacity for its controlled micro movement, which in turn restores proper femoral mechanics. One of the things that we will want to do is to unload the pelvis and to create more motion in an unstable pelvis. We want to also take away some of the other existing stabilizing structures to help the pelvis relax and reframe itself in the more optimal pattern. So we may do a lot of things like unloading your pelvis, like legs at the wall, a V stretch on the wall, but doing things to lower the tension that is influencing the pelvis and how it's moving in this inefficient and suboptimal way. Another thing that we would like to do is re-educate load transfer. So we want to work on teaching your pelvis to stay stable and move naturally with application of force. And we want to control how the force is applied. So we will go through the movement patterns that are the most effective and then work on creating environments to allow the pelvis to behave the way that we want it to after we've relaxed some of the existing stabilizing structures. To wrap up, your SI joint needs controlled micromovement to transfer force. When it's dysfunctional, meaning it's too loose or it's too stuck, it directly alters how your femur moves, leading to compensations in your gait, squat, and hinge that cause pain elsewhere. The problem might show up in your hip or your knee, but the root often starts at the pelvis. Figuring out whether your SI joint is unstable or locked is the first step to a real solution. If you're tired of guessing, that's exactly what we clarify in a one-on-one virtual movement assessment. I analyze your movement, identify your specific deviations, and build your personalized plan. If you are ready to fix your foundation, go ahead and book your video session with me at the link. It'll be in the description box. Now, comment below, does your issue feel more like the unstable or the locked movement pattern? Share this with someone who needs to understand their pelvic pain. Thank you so much for watching and keep building. I'll see you in the next video.